Cardiac arrest. Introduction. Cardiac arrest is a sudden and unexpected cessation of effective heart function, leading to a loss of circulation and oxygen delivery to vital organs. It is a life-threatening medical emergency that, if not treated immediately, results in death. Unlike a heart attack, myocardial infarction, which occurs due to a blockage in the coronary arteries, cardiac arrest is primarily caused by an electrical disturbance in the heart that disrupts its normal rhythm. Definition. American Heart Association, AHA. Cardiac arrest is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. British Heart Foundation, BHF. A cardiac arrest is when your heart suddenly stops pumping blood around your body. Etiology. Cardiac causes. Ventricular fibrillation, VF. Ventricular tachycardia, VT. Severe bradycardia or asystole. Acute myocardial infarction, heart attack. Coronary artery disease, CAD. Cardiomyopathy. Valvular heart disease. Congenital heart defects. Non-cardiac causes. Respiratory failure, example severe asthma, COPD, pulmonary embolism. Hypoxia, low oxygen levels. Hypovolemia, severe blood loss. Electrolyte imbalances, example hyperkalemia, hypokalemia. Drug overdose, opioids, sedatives, or other depressants. Electric shock. Severe trauma or head injury. Sepsis, severe infection leading to shock. Risk factors. History of heart disease. Hypertension. Smoking and alcohol use. Obesity and sedentary lifestyle. Diabetes mellitus. High cholesterol levels. Use of illicit drugs, cocaine, amphetamines. Family history of sudden cardiac death. Previous history of arrhythmias or heart attack. Pathophysiology. Electrical disturbance in the heart, VF, VT, or asystole. Down arrow. Ineffective cardiac contractions and loss of cardiac output. Down arrow. Cessation of blood flow to the brain and vital organs. Down arrow. Loss of consciousness and respiratory arrest. Down arrow. Cellular hypoxia and tissue damage. Down arrow. Irreversible brain and organ damage, within 4 to 6 minutes. Down arrow. Death if untreated. Types of cardiac arrest rhythms. Shockable rhythms, can be treated with defibrillation. Ventricular fibrillation, VF. Disorganized electrical activity causing ineffective heart contractions. Ventricular tachycardia, VT, without pulse, rapid, abnormal heart rhythm preventing effective blood pumping. Non-shockable rhythms, cannot be treated with defibrillation. Asystole, complete cessation of electrical activity, flatline ECG. Pulseless electrical activity, P. Electrical activity present, but heart does not contract effectively. Clinical manifestations. Sudden collapse and loss of consciousness. Absence of pulse. No breathing or agonal, gasping, breaths. Cyanosis, bluish discoloration of the skin. Dilated pupils. Seizure-like activity, in some cases. Diagnostic evaluation. 1. History taking. History of heart disease or arrhythmias. Recent chest pain, palpitations, or shortness of breath. Medication or drug use history. Presence of risk factors like hypertension or diabetes. 2. Physical examination. Unresponsiveness to stimuli. Absence of pulse in carotid or femoral arteries. No respiration or abnormal gasping. Pallor and cyanosis. 3. Specific tests and procedures. Electrocardiogram, ECG identifies arrhythmias, VF, VT, asystole, or P. Blood tests, to check electrolyte levels, cardiac enzymes, troponin, and drug toxicity. Chest X-ray, evaluates lung conditions, pulmonary edema, pneumothorax. Echocardiography, assesses heart structure and function. Coronary angiography, checks for blocked coronary arteries if myocardial infarction is suspected. Emergency management, basic life support and advanced life support. 1. Basic life support, BLS, immediate action. Check for responsiveness, tap the patient and shout for help. Activate emergency medical services, EMS, call for medical assistance. Check pulse and breathing, if absent, initiate CPR immediately. Perform high-quality CPR. Chest compressions at a rate of 100 to 120 per minute. Depth of at least 2 inches for adults. 30 compressions followed by 2 rescue breaths. Use an automated external defibrillator, AED if available, apply and follow prompts for defibrillation. 2. Advanced cardiac life support, ACLS. Defibrillation, for shockable rhythms, VF/VT. Airway management, intubation or bag mask ventilation. 4. Medications. Epinephrine, 1 mg for every 3 to 5 minutes. Amiodarone or lidocaine, for refractory VF/VT. Atropine, for severe bradycardia or P. Continuous monitoring, ECG, oxygen saturation and blood pressure. Post-resuscitation care, monitoring in ICU, therapeutic hypothermia for brain protection. Nursing management. 1. Ineffective tissue perfusion related to loss of cardiac output. Monitor vital signs, ECG, and oxygen levels. Initiate CPR and assist with defibrillation as needed. Administer emergency medications, epinephrine, amiodarone. 2. Risk for impaired gas exchange related to lack of breathing. Provide ventilatory support using a bag valve mask or intubation. Monitor blood gas levels and oxygen saturation. Position the patient to optimize lung expansion. 3. Anxiety, family, related to sudden critical condition. Provide emotional support and clear communication. Keep the family updated on the patient's status and treatment plan. Complications. Brain damage due to prolonged hypoxia. Multiple organ failure. Rib fractures, from CPR. Cardiogenic shock. Post-resuscitation syndrome, hypotension, arrhythmias. Prevention. Control risk factors, hypertension, diabetes, cholesterol. Regular exercise and healthy diet. Avoid smoking and excessive alcohol consumption. Medication adherence for heart conditions. Use of implantable cardioverter defibrillators, ICD, in high-risk patients. Education on recognizing symptoms and CPR training for the public. Conclusion. Cardiac arrest is a medical emergency requiring immediate intervention to prevent death and irreversible organ damage. Early recognition, prompt CPR, defibrillation, and advanced life support are critical for survival. Preventive measures such as controlling risk factors, lifestyle modifications, and public CPR training can significantly reduce the incidence and mortality of cardiac arrest.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.